We have our skin expert, Dr. Navjot Singh Arora, live from Delhi, to make aware on management of melasma and hyperpigmentation. Today, Dr. Navjot Singh Arora will share with us on management of melasma and hyperpigmentation. Doctor, welcome.
Thank you, ma'am.
And first of all, we would like to have some clarity about what is melasma. How would you like to define it?
So melasma is one of the types of hyperpigmentation. So whenever someone develops something which is darker than their particular skin tone on particular areas of the body, it is known as hyperpigmentation. So hyperpigmentation is a generalized term for any kind of pigmentation which is more than their usual skin tone.
To understand what are the symptoms and signs of melasma as well as hyperpigmentation, like the signs when we see, we should be aware and we should try to get in touch with our doctor.
So if you are experiencing brownish to darkish discoloration, especially in the cheek area, that is the around the cheekbone or on the nose or on the forehead or near the lips, which is a confluent pigmentation, not dot. If the pigmentation is in the form of a small or a larger patch, it may be very light brown, but it may be very dark brown also. So the color can vary, the intensity can vary, but the areas will almost always be this area.
When is the right time to go to the doctor?
They should go immediately, because the one problem with melasma is that, for example, a patient comes to me with one single or a very small patch. At least I can arrest the progression of melasma, or I can diminish the intensity of melasma. But if the patient is coming to me after many years and they have very large patches all over the face and nose, then I may be able to help the patient in some way or the other. But then the response rate will be very slow, and the amount of response which can be given in short period of time will be very less, and the number of medications and other peels and lasers required would be quite a lot.
Melasma से बचने के लिए विटामिन सही है क्या?
विटामिन सी, विटामिन ए, विटामिन ई, बीटा कैरोटीन, प्रोएंथोसाइनिडीन्स नाम के सप्लीमेंट्स हैं जो मेलाज्मा में कुछ हद तक काम करते हैं, मेलाज्मा की सिविरिटी को कम कर सकते हैं, और ये बहुत सेफ भी होते हैं लॉन्ग टर्म के लिए. विटामिन ए और विटामिन ई तो हम फिर भी बहुत लंबे समय तक लगातार नहीं खा सकते, बिकॉज दीज आर फैट सॉल्युबल विटामिन्स. बट विटामिन सी इज हाईली सेफ विटामिन, एंड इट कैन बी टेकन फॉर लॉन्ग टर्म्स. So yes, these are very safe. These can to some extent decrease melasma, but they cannot cure melasma.
Types of skin are more prone for developing hyperpigmentation.
So pigmented skin are more prone to develop hyperpigmentation.
Can melasma go away by using home remedies? A lot of people waste a lot of time because they think that maybe home remedy will do the wonder. What's your take on it, doctor?
So the problem with home remedies is that there is no quantification of which home remedy which person is doing, in how much concentration are doing. We as doctors are to have to we have a lot of responsibility when patients come to us. We have to advise them those things which are proven in randomized studies.
Like, subscribe, and press the bell icon. Thanks for watching.
To know more about on management of melasma and hyperpigmentation, watch the full talk show with Dr. Navjot Singh Arora from Delhi on Beautiful Spotless Facebook page.